Senator Cormann.
Thank you, Madam Acting Deputy President. The Tax Laws Amendment Medicare Levy Surcharge Thresholds Bill 2008 demonstrates the short-sightedness of this new Labor administration. At best, this bill points to a government that doesn't understand the flow-on implications of its actions. At worst, this is an ideologically driven attack on private health, an ideologically driven attack on those Australians that take additional responsibility for their healthcare needs. It is unbelievable that a federal government would introduce a measure like this without properly assessing the flow-on implications on our health system. This government introduced what they soothingly call a tax relief measure without conducting any proper assessment of the overall health policy implications. So much for the pre-election rhetoric that Labor would fix the health system, that they would end the blame game, that they were committed to private health, that the buck stops with the Prime Minister, that we would have a new era of cooperative federalism in health. If passed in this Senate, this measure will undermine the whole health system. Senators on the other side might think it is only targeted at the private health system, but I make it very clear that this will be a measure that will undermine our whole health system. The measures in this bill will end up hurting those Australians who are most likely to need timely access to quality hospital care. Older Australians who make the sacrifice every year to find the funds necessary to pay for their private health insurance so that they can have the peace of mind of having timely access to quality hospital care when they need it and not when the system tells them that they are high enough clinical priority. They have the private hospital option to complement their public hospital entitlement. Those older Australians will find it even harder than now to afford private health insurance. Many of them will be forced to join the long queues in our public hospitals, a public hospital system which is already under serious pressure. This measure demonstrates a clear lack of understanding by the Rudd Labor government of the policy framework that has underpinned the successful efforts over the past decade to restore balance to our health system. To assess the merits of this measure, of course, we will need to separate the government spin from the facts as revealed during the Senate inquiry. Now, the government tells us that this is a measure to provide tax relief to Australians who are doing it tough. Now, if the government takes the view that Australians in those income brackets are doing it tough and deserve tax relief, why are they discriminating against those Australians on those same income brackets who are also taking out private health insurance? Why don't they think that Australians who take additional responsibility for their healthcare needs are equally deserving of tax relief? They complain that the Medicare Levy Surcharge thresholds have not been indexed since they were first introduced in 1997. If that is a complaint, why is the government not indexing the thresholds? Why are they doubling the Medicare Levy Surcharge threshold for singles, with the disastrous consequences that became very obvious during the inquiry? There is absolutely no doubt that, if implemented, this measure will lead to many Australians abandoning private health insurance. Treasury tells us 644,000 people are expected to leave private health insurance, 57,000 of whom are expected to be Australians above the age of 65. That took quite a bit of prodding and inquiring because, to start off with, it was 485,000 people until Treasury finally conceded that they'd forgotten to take children into account. Now, private health insurance premiums will go up as a result of this measure if it is implemented. Now, don't take my word for it. Professor John Deeble, the father of Medicare, says it will be an additional 5% increase in private health insurance premiums over and above what is already expected to be the usual increase. Access Economics equally says that there will be at least a 5% additional increase in private health insurance premiums over and above what the normal expectation would be. Now, they are not the vested interests that the government sort of dismisses, they say, the Australian Health Insurance Association, you can't really believe what they're saying because they've got a vested interest. Well, here's Professor Deeble saying it will be a 5% increase, additional increase in private health insurance premiums over and above the normally expected increase. So what have we got? 644,000 to 1 million Australians are expected to leave private health insurance. There will be a 5% additional increase over and above the normal increase. This will lead to a second and third and fourth wave of people leaving private health insurance. The government, Treasury, the Health Department was trying to tell us how this will be a one-off shock to the system. This is quote-unquote the words that were used. This will be a one-off shock to the system. Now the reality is this. This will be the beginning of a new downward spiral, equivalent to the downward spiral in private health insurance membership that we've experienced between 1983 and 1996, when Labor was last in government. And make no mistake, this will result in additional pressure on public hospitals. It will result in additional pressure on public hospitals. There's absolutely no doubt about it. And you know what? During the inquiry, and I invite the Parliamentary Secretary, through you, Madam Acting Deputy President, to have a look at the evidence that Treasury and the Health Department gave during the inquiry. They were not prepared to put numbers over it, they were not prepared to quantify it, but they very clearly said, yes, we do expect that there will be additional pressure on public hospitals. So I'm quite surprised that the Parliamentary Secretary for Health and Ageing would come into this chamber today and interject and say, no, there's no evidence at all that there will be any additional pressure. Every state and territory health minister across Australia has said there will be additional pressure. But of course, in this conspiracy of silence, which thankfully came to an end on last Saturday, no state administration, no state and territory administration was prepared to prod too deeply and to sort of commission any independent modelling to sort of properly assess and cost the impact of this measure on their public hospitals. But I mean, hopefully that will be coming to an end very soon. Now, the reality is this, Madam Acting Deputy President, the policy objective of any government, the public policy objective of any government in health is to ensure that all Australians can have timely and affordable access to quality hospital care. Now, in Australia, we've been seeking to achieve that through a mixed health system. And our health system works best when we have a strong public system, a strong and well-funded public system, and a strong and well-supported private health system. That is the way this is the way the Australian system, in quite a unique fashion, has been able to achieve getting as close as possible to that objective. Now, the reality is this: in 1996, when we last came into government, private health insurance was in absolute free-fall. Private health insurance membership was in free-fall. It went down to 30% before we actually were able to turn this around through a range of policy measures. The Australian health system in 1996 was totally out of balance. And yes, through measures like the private health insurance rebate, lifetime health cover, and yes, the Medicare Levy Surcharge, we were able to turn that around. Now, if you look at the evidence by Mr. Kalish, the Deputy Secretary of the Health Department, during the inquiry, he said, the Medicare Levy Surcharge, when it was introduced in 1997, wasn't actually all that effective. Well, of course it wasn't, because you know what? As a new measure, it was probably pitched at a threshold that was too high to be immediately effective. This was a three-pillar policy where you had lifetime health cover, where you had the private health insurance rebate, and you had Medicare Levy Surcharge. And over time, all three of them together were able to achieve the significant increase in private health insurance membership that we've experienced over the last 10 or 12 years, and has been able to restore some balance into the Australian health system. Now, if you actually look at the membership trends over that period, there was an initial spike in membership of about 13 to 14%. Then it started to plateau off, and it sort of hovered around 43 to 44% over a couple of years. And then over the last 2 or 3 years, it started to increase again. 400,000 additional Australians took out private health insurance in the 12 months to the end of June 2008. Why do you think that was? It's because the Medicare Levy Surcharge at its current thresholds is becoming increasingly effective. And at a time when it's becoming increasingly effective, without any proper assessment of the flow-on consequences for our health system, the government just sort of draws a line in the sand. Oh, well, let's not, we might have complained that it hadn't been indexed, but let's not worry about that. Let's just double it. Let's not worry about what the flow-on consequences might or might not be on the public health system, on the health system overall. Now, what does this measure actually do? What does the government expect to happen? What are the government's assumptions on all of this? Well, it was quite a bit of work to get that out of Treasury and out of the Health Department. we now know that the government expects 644,000 people to leave private health insurance. They expect to save $960 million over the forward estimates from not having to pay the private health insurance rebate to those people they expect to leave. Now, when the Parliamentary Secretary earlier was interjecting how they're going to be the young and healthy, there will hardly be any impact on public hospitals because the people that are leaving wouldn't be accessing services anyway. But you know what? If the government expects to save $960 million because they no longer have to pay the private health insurance rebate, and if those people are young people, then that $960 million only represents 30% of the total funding of hospital treatment that will be lost to the health system. Now, does anybody here expect that demand for hospital treatment is going to reduce over the next couple of years? I don't think so. So if $960 million is only 30% of the funding that is lost to the health system to fund hospital treatment, what is the total number of funding that is going to be lost to the system? $3.2 billion. Now, when I brought that up at the inquiry, the Deputy Secretary of the Health Department said, well, but there are the profits of the health funds. And they might not spend it all on funding hospital treatment. Yeah, that's true. They don't. And you know what? If somebody had bothered to have a look at the Private Health Insurance Administration Council website, very good website, with a lot of facts and figures, a lot of industry statistics, Treasury never even looked at it, Treasury never consulted with FIAC, well, you would have found that only 15% goes into either the cost of administration or a small net surplus to fund future claims. So we're talking, if we're sort of saying that out of $3.2 billion, 15% goes into the cost of administration and a small surplus to cover the cost of future claims, then we're talking about more than $2.7 billion that will be lost to the Australian health system as a result of this measure. And the government is trying to tell us that there won't be an impact on the level of services available to the Australian people. Who is going to fund it? Where is the funding going to come from moving forward? I mean, this is the biggest cost shift from the Commonwealth and the privately insured, not just the Commonwealth, from the Commonwealth and the privately insured to the state and territories and to the public hospital system. And nobody has done a proper assessment of it. Nobody has made an assessment of how much additional pressure our public hospitals will face. Nobody has made an assessment of how much it will cost. And nobody has put their hand up to say, OK, well, we acknowledge that there is going to be an additional cost that you're faced with. We acknowledge that you're going to have some additional pressure in terms of meeting the demands of Australians that need access to quality hospital care. So we will compensate you for it. Because you've got this huge politically motivated conspiracy of silence across Australia where, I won't blame you if you don't blame me. Let's just keep quiet about it. Like, 12 to 14 months ago, if the previous government had introduced a measure like this, I'm pretty sure that all of the state and territory Labor governments would have come together and they would have commissioned some independent research. They would have gone to Access Economics and say, here's a public policy measure at the federal level which is going to have an impact on us at the state level. Please tell us how much it's going to cost to deal with the impact of this. But what have we had? Just some token resistance at the state level. We are sort of, we think there's going to be some additional pressure. We don't really know how much. Oh, well, in the paper they say 485,000 people will leave private health insurance, but they're all young, so it won't be so bad. So what else do we know? So here, Treasury, in their evidence, have said to us, OK, well, yes, we expect to save $960 million because we no longer have to pay private health insurance rebates to those that will leave. So is that really true? Because Treasury then also tells us we haven't made any assumptions whatsoever when we calculated that figure on whether there's going to be any impact in terms of future health insurance premium increases as a result of this measure. Now, 5% is what Professor Diebel says. There will be a 5% increase in premiums over and above any normal increase as a result of this measure according to Professor Diebel. Now, the Commonwealth has allocated more than $14 billion over the forward estimates for the private health insurance rebate. A 5% additional increase is in excess of $700 million. When I ask questions about that of the health department officials, they say, oh, well, no, we haven't costed that as part of the savings in the budget, but we've allocated that into the contingency reserve. So how much have we allocated in the contingency reserve to cater for this? Well, we can't tell you. That's secret. That's commercial in confidence. That is, well, just like you. So this is secret. We can't tell you. So you know what? This saving and this $300 million saving over the forward estimates is a fraud. The true cost of this measure has been hidden in a contingency reserve. You know, you tell us that you're going to have a $960 million saving over here, offset by a $660 million loss in revenue. So you say, oh, well, we'll have a $300 million saving over the forward estimates. It's a fraud because you've hidden the true cost of this measure in the contingency reserve. You know that private health insurance premiums are going to go up as a result of this measure. Professor Diebel says 5%. Access Economics says 5%. Health funds tell you up to 10%. But let's just sort of, you know, be conservative. Let's just say 5%. More than $700 million that it will cost to actually cope with that additional premium increase that you haven't, you know, made public in your budget papers. Now, I mean, so where are we now? So is it going to be the young and healthy leaving? You know, if it is the young and healthy leaving, does that mean there's not going to be an impact on you know, public hospitals? What does it mean for community rating? The reality is this: the more young people we can attract into the private health system, the more affordable it is for everyone. The more affordable it is for everyone. The more affordable it is for older Australians. Because if you discourage young people from, you know, if you discourage young people from taking out private health insurance, what you are doing is you're forcing premiums up for everyone, in particular those older Australians who need that access so desperately. Now the government then tells us, but we've allocated a $600 million you know, elective surgery reduction strategy package, which was a pre-election package. Well, that was another fraud. I mean, essentially, this was a pre-election commitment that was made before they ever spoke about this particular measure, and then all of a sudden, as they get under pressure about the impact on public hospitals as a result of this measure, but we've got this $600 million that we are, you know, providing to ensure that we reduce, you know, elective surgery waiting lists. Now, have a look at the fine print to make sure what's actually on the table. If you look at the fine print, only $150 million as a one-off payment to fund additional services and to reduce waiting lists. So they're here, $600 million package, big headline, but only $150 million has been committed to actually fund additional services across Australia. Now, put that against the $2.7 billion loss in funding for hospital treatment as a result of this, and this is clearly inadequate. Now, and the Parliamentary Secretary is shaking her head, but I just find it unbelievable. You've got a government that sort of comes out and before the election and says, we're committed to fixing health, we're committed to ending the blame game, we're committed to working with the states and territories, we're committed to private health, and everything they do when they come into government is totally different. Everything they do when they come into government is totally different. If they were committed to cooperative federalism on health, why would they not give access to the states and territories of the modelling they've done of the impact of this measure? Why would they not provide access to that modelling so that the states and territories could make a proper assessment of the impact on them, to make sure that they can run their public hospitals in a way that is, you know, that properly caters for the demand that is likely to come their way? Now, I mean, I still haven't received an answer for this. I mean, not one state and territory government has actually asked for additional funding. I mean, how come? Like, everybody's out there sort of saying, oh, there's all this demand that's coming our way. But when I ask questions on notice, well, is there any state or territory administration that has asked the federal government for some additional funding to compensate for this measure? No. No, not one. Not one single one. It's just incredible. Like, so here we're all saying there's going to be all this additional demand, but we're not going to try and find out how much it is. Like, this measure is bad news. It will result in hundreds of thousands of Australians to leave private health insurance. It will push up premiums, which will hurt, in particular, older Australians who are already struggling every year to find the necessary funds to afford their private health insurance. You, as a government, are pushing up the price of premiums for those older Australians. You're forcing them out of health insurance. You're forcing them into those public hospital waiting queues, into those public hospital queues, and you're not offering any proper compensation for it. And at the first opportunity you had to work with the states and territories to make sure that the flow-on implications of a policy measure at your level were properly catered for at the state and territory level, you failed to do so. And, you know, as a closing remark, I hope that now that we've had a change of government in Western Australia, I would urge the Barnett government to commission a proper assessment of the impact of this measure, to commission a proper analysis of the costs that are likely to come their way as a result of this measure, should it pass the Senate, so that they can make an informed claim to the Commonwealth for additional funding.